the way I see healthcare industry moving forward in India is on the delivery side, we more or less reached our limits in the hospitals, and that's a challenge, because in terms of costs, I think we've really in a mode of cost overrun, and there is no way that nobody has a answer to how these costs will be minimized. Yes, of course, some technology inputs, some EMR, some documentation, all that stuff, but still at the end of the day, we need to really prevent people from coming to the hospital, and that's where our focus needs to be, and globally that is where it's happening. The money is in not allowing patient to come into the hospital, so the money is in keeping the patient well, and the way to keep a patient well is to figure out, to track a healthy human being through development of risk factors, and to say how do you mitigate risk factors to prevent or delay the hospitalization. And the hospital should be used only for acute care, where what you can't do at home. So therefore, now no healthy person ever goes to a hospital. So what do you need to do? You need to test them routinely for identifiable risk factors, at least in the long-term chronic care diseases or the identifiable risk factors that we know, so that we can, at a much lower cost, because testing these annually or 6 monthly or once in 2 years doesn't cost much, but an episode in the hospital can make a person, like, they can really drop them to below poverty line. So therefore, what we are offering in the market at EBA is what we should be doing, hit larger healthy population, track them through risk factors, and to really see how we can study the trends of people, and then compare them with the research that has shown that, okay, for a particular pattern, what is the behavior and what are the risk factors for developing stroke or cardiovascular disease, and then to address the population like that. So really move from a patient health to a population health, and in that journey, it is the person who has never hit the hospital that is important. So I think that's where we have a large role to play, and that's where globally the markets are moving.